We are back on the Credit Human pregame show. It's time for our medical feature, featuring the doctors that help out the student athletes at UTSA. It's brought to you by UT Health San Antonio, the official healthcare partner of UTSA Athletics. Dr. Cynthia Cantu joins us. We're going to talk about sleep. And, Doctor, this is vital to not only regular people, but certainly athletes. You got to rest, don't you?
Absolutely. It's very important for overall well-being to get a good amount of sleep every day.
All right, let's talk about that. Do you have to sleep the same amount of hours every day at the same time? How do you get into a sleep pattern or kind of a sleep zone, if you will?
Yes. So it is recommended by the American Academy of Sleep Medicine that you get at least 7 to 8 hours of sleep per night. And to do that, it's important to adapt a sleep hygiene. And so that's just basically adapting a routine every night. And that what that means is that you want to not exercise 2 hours prior to bedtime, which is, I know, is tempting. Not use your phone. Make sure everything's dark. Make sure not to be drinking or smoking right before bedtime. Making sure you're not eating a large meal also at bedtime. And as well as not taking daytime naps. And if you do, just less than an hour is preferable. The other thing is very important is making sure you're sleeping at the same time every night.
All right. I've had a friend before tell me that he goes into a pre-sleep routine before he actually goes to sleep, which is kind of like winding down, kind of zoning out. Maybe the TV's on, but he's really not paying attention to it, just kind of chilling out a little bit. Is that a good recommendation, not just work right up until it's bedtime?
Yes. It is. If it works for that person, that's fine. In general, though, it's actually better if you put some relaxation music. You can put some rainy sounds. That's what I usually recommend to my patients because you're not paying attention to the music. And that way you're not activating your brain with TV because on the background, it is still activating your brain. All
right, let's talk about the athlete because sometimes they play late and they're starving afterwards. Then they go to bed a little bit later than normal. How do you adjust when you've gotten out of your sleep hygiene routine?
Absolutely, I understand that. It would happen to me before as well. I would recommend, I know it's tempting to eat a large meal, but if possible, just eat smaller than usual. And then, of course, eat a good breakfast the next day. Go back to going to sleep at the regular time. Don't overdo it because you think that, I only slept 5 hours, so I'm going to sleep like 10 the next day. That actually is going to make you feel more tired.
Yeah, that's what I was going to ask you. Is there such a thing as too much sleep?
Yes, definitely. Some people do exaggerate, and then at that time, there may be something else going on that we have to explore.
All right, so you mentioned naps. If you do take a day nap, a cat nap here and there, how long should it be or how not long should it be?
It should be less than an hour. I really prefer more like 15 to 30 minutes, nothing longer than that. Mm-hmm.
That's Dr. Cynthia Cantu, part of the UT Health San Antonio team, taking care of UTSA Athletics. And that's today's medical feature, brought to you by UT Health San Antonio, the official healthcare partner of UTSA Athletics. For more information, visit uthealthcare.org. More of the Credit Human pregame show coming up next. This is Roadrunner Football from Learfield.